You can give compressions, you can work on a pulse, and we'll do all that today. Class is pretty easy. An easy 2 hours. There's 11 question tests as a group. It's a piece of cake. What we're going to do till about 10 o'clock, he'll go over all this stuff. 10, we'll take a 5-minute break, and then we'll just start lining up here and doing the practical part. And he's going to go over some tourniquet and bleeding stuff with dogs, and then take the test, and we'll be out here right around 11 o'clock. So again, thanks for coming, guys. I appreciate it.
Okay. Yeah, like Eric said, there's been a big push now, especially with the SWAT and tactical medics, to offer this training to the canine because the dogs are very important. So, and we're treating them as if it was an injured officer. So that's kind of where we're going. The thing that's different is the tactical medics may not be the one working on your dog. You're the one that's going to, because first of all, the dog and you are more acclimated to each other. So it might be aggressive towards me because it doesn't know me and it's injured. So that kind of complicates stuff. So this mouse works. Okay, the first thing that we like to talk about are vitals. And if you talk to your vet, they will give you some information on how to check your dog's vitals. And you should kind of know this stuff at a baseline anyways. Know what your dog's heart rate is, know what their normal body temperature typically is. So all these different things here, respiratory rate, capillary refill, are good to know before there's an incident, so you can kind of gauge that. Blood pressure, if you know when you go to the doctor's office and stuff like that, we get our blood pressure checked. In canines, it's very difficult to obtain that. Okay, so we really don't go by that necessarily. Heart rate, usually we can check it by only placing a hand over the heart, okay, and the femoral artery. Not like a human where you can find a carotid artery or a brachial artery. It's very difficult to do it, so we go for the femoral. Okay, a couple of Canton's K-9 handlers did check their dog's femoral artery, and they said it was pretty easy to find. So that might be something that you try and know where that's at. You know, so in case of emergency, it's not that hard to find it. Okay. Your dog's gums. Generally, the mouth of a canine, and you can tell a lot about what's medically wrong with them. Okay. And capillary refill, and I don't know if I explained this the last time, and I apologize, but if you take your finger, okay, find your nail bed. Everybody's nail bed should be white. Okay. If you press on it, I'm sorry, it should be pink. If you press on it, it turns white. It should be immediately pink again within a second. Okay. Your capillaries are the lowest point, the furthest point where your body's circulating blood. Okay, so you got all the arteries and veins and kinds of interstitial tissues that are being circulated with oxygenated blood. And at your capillaries is where you know that you are perfusing fine. Now, if you touch your finger, okay, and this isn't in all cases, and it doesn't come back to being pink within 3 to 4 seconds, there's a circulation problem. Okay, you're not circulating properly. Okay. And then with the canines, we check that in the gum line. We can take back the lip and push on their gum, and it should turn white and then perk back up to pink within 1 second. Okay, so if it doesn't, again, that's how you tell that they're not circulating blood properly. Okay, normal body temperature for your canine should be about 100 to 102.5 degrees. Okay. The only way to really check your dog's temperature in the vet's case is they do a rectal temp. I'm not suggesting you do that. It's just I just want you to be aware that that should be your dog's normal temp. Now, as you can see, that's a lot higher than humans. Okay. And we all know that they can get overheated very easily when they're working, they're on a chase, on a search, sitting in the car. We got to really, and the only way they can regulate their temperature is through the pads of their paws and by breathing that off, by panting. That's the only way they really regulate their temperature. Heart rates are 60 to 100. Dogs normally do beat a little faster than us, and that's fine. Okay. Again, when you go back to your station and check your dog's femoral artery, try to time that. See how many beats they actually beat in a minute. Okay. If it's around 80 beats a minute, that's where that's their normal resting heart rate. Okay. Don't check it after they get done doing a workout or they're doing a training. Okay. Do it when they're at rest. Respiratory rate is about 15 to 30. Okay. They should be about 15 to 30 breaths a minute. Okay. Now, panting can be confusing, okay, as what they're really breathing. Again, the capillary refill time is 1 second. Okay, restraints. I know I don't know the other agencies, they are carrying restraints or muzzles, okay, and just a quick muzzle put it on there, okay. If there's any type of injury, right here's one. I'll pass this around so you guys can see it. These are great because what this allows is there's still an opening to give breaths. So if we put that muzzle on, we can still give breaths and still be able to secure the tongue. Okay, if the dog starts to puke or anything like that, it still allows them. It's not a full restraint like this. That might be a bit much because they really can't open their mouth. If you look on the bottom left there, these are pretty good and they're quick to put on. So we'll start that over here.
So the guys from my training group, Clapper and Shane Beam, are going to buy 30 of those. So we'll have one for all of our guys. Get them out. We'll have to put one in the swap bag and we'll have some extra. So Chris keeps that in his vest at work.
And this is just to protect the dog. They're going to be, if they've been stabbed or shot, or they've ingested some type of drug, they're going to be very confused. Okay, their level of consciousness might deplete, and they might not recognize who you are, and you might be a threat to them. Okay, so once you get that muzzle on them, that helps them, that they don't bite you or bite anybody else. Okay, choking. First thing is to make sure that they are choking on something. Again, it can be confused if they're on a surge or they're in training and then they go to the water, get some water and they, start drinking it real fast and they start coughing it up. It's almost like they're choking, like they're gagging. Okay. Make certain that it is a foreign body object they are choking on. Okay. If it is, and you can see it, you can pull it out, but you got to watch. You're sticking your hand in there, and there's a lot of teeth. Okay, they could clamp down. The Heimlich maneuver is really simple and easy to do. If you got YouTube, there's some really good YouTube videos of that. Okay. And for the larger dogs, this is the best way to do it. Now, there's other techniques out there. There's one where you can actually pick the dog up upside down. I don't know if I recommend that one because that could be dangerous if you drop the dog, things like that. This seems to be the safest one out there, and this is what they are recommending to do. Okay. Okay, opening the airway. And you can see on this is our CPR mannequin here. When you're opening the airway, you do have to pull the tongue. Okay, and these mannequins, you can't pull the tongue. Okay, this is a little excessive, but K-9's tongues are very large. Okay, and why do you think we have to pull the tongue out of the mouth? Yeah, because their tongues are proportionally larger for their snout. Okay, so if we don't pull that out, it will occlude that airway, and it will compromise giving them ventilations. Okay, so do pull that out, get the muzzle on, and that helps even secure the tongue as well, having that muzzle on there. Okay. Okay, and as you can see, you're pulling the head back. Okay, you're going to pull the head back because you're making that trachea mid-line. Okay, you don't want to be this way on the dog and pull the head towards you because that's closing the airway off. Okay? So always from the back side of the dog, from their back. That's the position you should be, pulling the head back. Okay. Also, you're visually inspecting their snout, their mouth, if they've ingested something through the mouth. Okay. You got to watch that too. You may want to have rubber gloves on, and depending on what type of drug or chemical they might have been in, because drugs like acid and stuff like that, it can be absorbed through your skin. Okay, and especially if your adrenaline's pumping because it's a stressful situation and you're sweaty, it opens your pores up, and whatever that dog has ingested could, in fact, be transferred through your skin. Okay, as we're checking for breathing, so we opened the airway, we secured the airway, it's patent, we have the tongue secured, we're checking for breathing, okay? The best way to do it, and it's just like if you've taken regular human CPR, is to look, listen, feel method, okay? You're actually down here, you're listening for breaths, you're looking for the chest to rise, you're trying to feel if you can feel any condensation from the mouth or nose, okay? And then we're going to check circulation, and the femoral artery is the best way to do this. Okay, this is a picture that just illustrates checking for the artery, but they do have that oxygen mask. I don't know if you guys have ever responded to any fires with your local FD, and they may have pulled dogs out of the fire. If they've been some type of smoke inhalation or asphyxiation from some kind of bicarbon, usually oxygen's all they really need to get perked back up. Okay, dogs' hearts are generally pretty good. They don't suffer